Okay, so certainly not least, our last presentation is going to be from April Wood at the American Red Cross, who's going to be talking about this crazy virus that is affecting all of us. So I'll let you take it away, April.
Thanks, Emily, and I'm going to attempt to do a live demo. What could possibly go wrong, right? So let me share my screen here, and we will jump right in. My name is April Wood, and I work for the Disaster Operations team at National Headquarters. And I have been leading a project in partnership with Esri and the team at Blue Raster to develop a collaboration hub, once again using Esri's hub technology to be able to do and promote two-way data sharing. So I'm going to show you a couple of different things. Can you guys see my screen? We good? All right, I'm going to minimize everybody so we can see. And first, I'm going to show you the inside sneak peek. So this is in Portal. This map is not public facing, unfortunately, at this time, but this is how internally at the Red Cross in our portal RCView, which is Red Cross Visual Interactive Event Wizard, that we're developing and using maps. I did remove the layer of the overlay of the COVID-19 cases currently by state and county, just so you could see the map. This map started out all green with a little yellow. Green was no public health emergency. Yellow is declared public health emergency. Orange.
Sorry to interrupt, April. We still see the Welcome to the Disaster Partner Hub banner page.
No, thanks for that. Okay, well, I switched over on you. Hang on, let me try to reshare one second. Let's see. We have to do this twice because I had two different tabs open. All right, here we go. Now you should see it.
We see a map now. Great, thank you.
Great. So the orange is government-directed social distancing, and then red is government-ordered stay-at-home orders. This is not authoritative data. This is just the Red Cross's interpretation of what we are receiving from our regions across the country, but it's helping drive us with our mission service delivery matrix that we developed back in January to make decisions about how we were going to adapt our programs at the Red Cross to keep our volunteers safe, but still allow us to respond to disasters in a COVID-19 environment. So I just want to give you guys a quick sneak peek at this, and one other tool here that is also internal, private at this point, but this is a regional risk tool, and I'm hoping it's going to load because it's a lot of data, but it's pretty cool to see. I'm going to make it bigger. This is using Power BI. We have taken our historical data at the American Red Cross for the last, from July of 2011 to December of 2018. We're working on 2019 right now, and we have overlaid the projections from the University of Washington for COVID-19 deaths, average daily deaths. And so at this point, we are able to use this planning tool and this disaster hazard propensity tool to break down by regions across the country what our highest probability disaster event is so that we can be ready for that to occur, while at the same time understanding the high projections, the low projections, and then the middle line, which is the average projections of potential daily deaths occurring. This is the aggregate across the U.S. Looking to peak sometime around mid-April, a little over 2,100 deaths. And then we have the ability to drill down by region, for instance, and be able to see in Mississippi, for instance, their highest propensity for a disaster is looking at flooding. That did not work for me. So looking for flooding there in the Mississippi region, and you would see their curve is a little bit flatter. So they're anticipating roughly about 91 deaths per day and peaking around April 23rd for the Mississippi region. So I'm going to stop sharing my screen for just a minute while I switch back tabs so that you guys can see the other piece I had to share. And we will jump back into the Disaster Partner Hub itself. So part of the work we have been doing to build this partner hub that is still in development, it's not scheduled to launch for another 4 months with our operational partners across the country we respond to disasters with, is we've been building out 4 areas: multi-agency applications in support of feeding, sheltering, disaster assessment, and call center data. So I'll give you a couple of peeks into the hub itself here. This is the landing page. We've got a number of planning and resources, sharing data, and ongoing disaster response as part of our tabs. We've got a page introducing the disaster feeding tools that we just released this week. We are planning to go live with the hub on Friday of this week with our national feeding partners to provide them early access so that we can start looking to track some COVID-19 disaster feeding that's taking place across the country. We have our situational awareness briefs, and I'll show you an example of the COVID-19 partner brief, basically using the story map capability from Esri to do that. It's how we package situational awareness information for our partners. We've got an open search data function, and then I'm going to jump over from there and show you guys our feeding apps. In addition, we have one other application here before I jump to feeding. This is our planning and resource map. So this is intended to be able to use during blue sky planning. So on the map here, we have our Red Cross chapters and regions laid out. We have the food banks from Feeding America, the network of over 200 food banks across the country integrated here as well. We have a faith-based example of the Pentecostal Church Network in navy blue. And then if you were to zoom in, you would see other examples like NAACP branches across the country. You would see a live feed of Walmart stores taking place. And so I'm going to jump over to feeding, but we're just trying to overlay a lot of disaster information in one place for people to know who to reach out to in their local communities as we continue to build that out from our initial data sets. This is our disaster feeding page. We have a number of applications that have been created here. The first one is just a survey 123, and we pre-populated a lot of the names of organizations that are doing disaster feeding across the country. It's a dynamic survey, so if you click on mobile distribution, for instance, you would see the number of vehicles as part of the data points collected. But if you were to click on a fixed kitchen, for instance, you might see planned first meal as one of the survey fields that would show up in addition to the location. All of this information feeds the second application, which is daily feeding activity. We have our test data in here currently that we're looking to wipe clean tonight as we start the launch this week for the pilot. You can sort by disaster, which we've got COVID-19 locked in here for the purpose of the pilot. Once again, organization name and by county. And if you were to click here, you could submit a daily feeding report, which is very simple and short, and then you can update your feeding resource here as well to keep the information current and maintained. All of this information feeds our disaster-wide feeding dashboard. So this is the second tab here, but this shows you meals produced, meals served, and food boxes distributed across the country. Those are really critical pieces of information when you're trying to make decisions about providing feeding support with many partners across the country. So it also rolls up into the number of feeding resources, the maximum meal capacity, the resources by disaster, by status, by type, and then of course by organization here at the bottom right as well. We will also be releasing soon our emergency response live vehicle tracking, our near real-time ERV tracking, as we like to call it. So that'll be an exciting new addition when we roll out the hub to our operational partners. And then finally, the last resource here is essentially just a web app. And so being able to build the web app, I added in the USDA Summer Meal Sites 2020 data that just became available in the last couple of days. I also have, these are earthquake fault lines that I have included here. So a wealth of information included in the web app from demographic layers, weather, natural hazards, locations of importance. And as we continue to build out layers of data within the hub, you could add the Feeding America Food Bank once again. We're looking to add the Feed the Children Food Network. We're talking to Food Finder tomorrow, who has some of the largest aggregate of information across food pantries across the nation. Really, once again, trying to hone in on capturing a snapshot of what feeding looks like across the country at this point. I'm also going to jump over and show you guys our partner brief. So this is once again using this story map capability. This is how the American Red Cross is sharing information with our operational partners that do not have access to our portal, with that being an internal enterprise use for us. So we have everything from the Hopkins maps located here by county and by globe, and we have the NAPSG resources included at a state level. We have the healthcare ready maps included here. We have the FEMA health and medical lifelines, which is how FEMA is categorizing all of their responses nowadays via the lifelines. And then we just have some additional information that we've included. Walmart has produced its first dashboard of Walmart stores with the near real-time feed that's available in RTS Online. It's showing their grocery store availability and online grocery pickup and pharmacy status, which is really helpful from a decision-making perspective as well. And then certainly looking at some other things we have included here on the planning tab, we have a number, once again, of data sets around the USDA summer meal sites and overlaying the Red Cross chapters with the Feeding America food banks once again. And finally, we've included the curated set of demographic maps where we have the collection that Esri has put out showing the 8 different maps around social vulnerability, age population 65 and over who are still working, 65 and older who are live alone, broken out by county, which is an incredibly important data set when you're planning for disasters and how you're going to support the community. You know, in addition to just the general population of 65 and over as a high-risk group that is being shared with. And then some other sneak peek into the hub, not necessarily related to COVID, but looking at our embedded story maps for weather across the country. I left this up from yesterday. It's rare that you see this much activity on the weather map. And so yesterday afternoon across the country, we had, 10 severe thunderstorm warnings and a tornado warning with additional special marine warnings all at the same time. This is also the place where we show open shelters. I'm not going to click on that. It's underwhelming. There are 0 congregate shelters open in the country right now for disaster, which is how we would like to keep it in a COVID-19 environment. And we are working hard to support our partners and be able to provide people a safe place to stay. This is also our incident tracker map. So this is where we share with folks what's going on across the country, and it's interactive. So if you click, you have a tooltip box that shows a single family fire occurred in Florida. This is updated in a 24-hour period. Once again, I chose not to refresh from yesterday for the purposes of being able to see some of the richer data. We have a trigger around a death occurring, and so that's part of our reporting process and shows the Red Cross is responding and provided health, mental health, and casework support. And then finally, just closing out, we have some additional work in development currently. So this is the dev environment where we are looking to be able to share our call center data and overlay this with call center data such as 211 data, crisis cleanup data, OnStar data out of General Motors. We had some conversations with them, and the FEMA the call center data as well. So as we look to be able to better understand who is calling and from where, we want to make sure we can visualize that and make decisions off of it to inform all of our service delivery. So we have taken in about 37,000 calls this year. We've got 60% of them were for food, 53% for water, and then financial assistance and short and long-term housing were our additional pieces of data that have come into our call center. So with that, I'm gonna pause and take any questions. Thank you guys for allowing me to join you this evening for my first GeoDC event.
Very nice. First one. Woo! So we had a jokey question from Dave. If you needed a real-time Walmart toilet paper feed. Right. I don't know if he has access to that or what that question was about, but
I'll pass that back to Walmart.
Okay, but for real, some other questions. Let's see. Janet noticed that in the hazard risk calculations, she's wondering how the hazard risk was calculated because she noticed that the New York City region had a 20 and the Gulf Coast had a 1.
Yeah, so the disaster risk data is only Red Cross data, so it doesn't take into account any other factors other than Red Cross data of where we have initiated relief operations, disaster relief operations over the last 7 or 8 years. They did a number of pieces of the algorithm that help inform what that propensity was, and it is propensity. It's based on historical data, but it's still looking at modeling for the future around the propensity. So I'm guessing Hurricane Michael helped skew that quite a bit, even though New York had Hurricane Sandy back in 2012. But I'm guessing the impacts from Hurricane Michael across the Gulf Coast probably help push that in that direction from a ratings perspective, as well as flooding and hurricanes that happen more often. I'm sorry, not flooding, flooding and tornadoes that happen more often across the Southeast as opposed to the Northeast.
Cool. We had another question. How will food banks be used in this time of economic hardship?
Yeah, so the food banks are really seeing an increase. I think I saw today a 40% increase in requests for food assistance as we continue to see food insecurity be top of mind at the federal level and across many of the voluntary agencies that are supporting during the COVID-19 response. They are certainly helping augment wherever they can. We're seeing a lot of feeding with the school systems, and so the summer meals program have really kicked off, even though school's not out officially yet. But we're seeing that all across the country, large scale events. I saw that the Los Angeles region today in partnership with the city and the school system and many of the other voluntary partners. I think they were celebrating over 3 million meals they have distributed to children just in the last a couple of weeks. And so really, really high volume. The Salvation Army today was estimating 500,000 meals a day that they're also putting out across the country. And so lots of feeding is ongoing, which is why we're hoping to be able to track some of it and get a broader understanding of who's doing what where using the GIS tools.
Yeah, it's crazy the amount of food assistance that you have to think about, especially with all the schools being out and everything like that.
Yeah.
All right, we got one more question from Sophia, which is, how has the shift to physical distancing enhanced or hindered Red Cross operations?
Yeah, that's a great question. So as I mentioned, we've been planning since January. So we were on the front end of this before we started seeing a lot of cases here in the U.S. One of the things we've suspended is our home fire campaign, our in-home smoke alarm installation. So we made a decision from a risk perspective that putting volunteers inside someone's home right now during a pandemic was probably not the best route we wanted to go. So we are erring on the side of whatever we need to do to protect our volunteers, while at the same time ensuring that we have the ability with both human and material resources to respond to disasters at a local level with appropriate personal protective equipment if needed, and in collaboration with local public health and emergency management. We are excited to see everything working virtually really, really well at this point. We have had our operations center activated at an enhanced watch using a virtual watch floor in Microsoft Teams for, gosh, 3 or 4 weeks now. So we're all excited about the new opportunity to leverage technology in a way we've not been able to do so before.
Cool. Well, thank you again.
Thanks,
I
guys.
think all of our